Hi, I'm Lee Kelso, host of the Health Call Live Radio Hour. I am glad you are here. I think we're all probably pretty sick and tired of the thought of being tested for COVID-19, but now, at least in the Fort Wayne area, it is easier than ever before. And that's because a company called Curative has opened a testing kiosk in the Fort Wayne area. The Senior Director of Operations is with us today, Blake Lackey. Tell us about this new kiosk, how we use it, and a little bit more about testing as you are performing it.
Great. Thanks, Lee. Really appreciate being able to be with you today. And we're very excited about rolling out this testing modality in Fort Wayne, Indiana. Glenbrook Square Mall is where our kiosk is located, 4201 Glenwater Road. We operate 10 a.m. to 4 p.m. We conduct a very safe, easy, and effective PCR test from that site. Which is just a lower nasal swab right in the beginning of the nasal cavity, 15 seconds on each side. That sample is then shipped off to one of our 3 CLIA certified labs, and results come back within 48 hours via text or cell phone, text or email.
So you're not going deep into my brain. Check. That's a good thing. We like that. And it's a PCR test. So what is your accuracy rate on that particular modality?
Yeah, absolutely. So the PCR is, as we know, is really the kind of the gold standard in all of testing. The efficacy rate hovers generally around the 90 to 94% percent, and which really again separates that from some of the other tests that you might see out there, specifically an antigen test. Though an antigen test does result within 15 to 30 minutes. You get the certification from a CLIA lab that a PCR test has been conducted, and you get the understanding that efficacy at that 90 to 94% is going to tell you what's going on, which is what we're here to do.
All right. So a small number of false positives or negatives, that's the big outcome. So do I need an appointment?
So ultimately, anyone that comes to our kiosks there in Glenbrook Square Mall will be seen. It is easier if you go on curative.com to book yourself an appointment. You're able to do that very easily from our scheduler, which is a web-based scheduler online. However, if you're just dropping by and you want to stop by, we will take care of you, register you there on site. So walk-ins are absolutely welcomed.
I've not been out there. Is this a kiosk that is in the parking lot, or is it inside the mall? And do I have to get out of my car if it is in the parking lot?
It is in the parking lot, and you do have to get out of your car in order to be tested. It is very easy, very safe, and very fast. The whole process could take you probably at the high end 10 to 15 minutes.
Do I need to pay anything? Do I need insurance information? What's the cost if there is one?
Yeah, so this is no cost testing, and no cost testing is really great because ultimately, as you come to conduct the test, we obviously take public and private insurance, but we also have the ability to go back to HRSA and the CARES Act funding, and to ultimately get that test paid for, as long as you're able to attest that you are the person that you say you are, which we ask you in your intake form.
So I was just at a performance, and for the first time, Blake, I had to provide evidence of either vaccination or a negative test result. So what I get back from you, does that qualify as that negative test result? Is it a document, an email? How am I going to show that to somebody?
Absolutely, and that's the great thing about our process and our system is that email is and that text is on your phone. It does obviously count as a certified PCR test. You're able to utilize that to gain access to anywhere that is going to accept those types of tests, or I should say, that is going to require any type of COVID testing prior to entry.
What about genomic sequencing? Are you going to tell me what variant I am infected with?
So though our company does do sequencing is really held kind of at that higher level, at the DOH level, and so we will not disclose specifically what type of variant that you would have, because again, there's some legalities that are tied into that, across the municipalities. But ultimately, we provide you that good understanding of what exactly is going on, as we all have kids that have started school again. It's a really crazy time, especially with new variants that are out there. And so ultimately, we're providing some great information that's going to enable you to make decisions and to get back to your life at times when needed.
And is there any limit on the number of tests I can receive? So, for example, if I do have to provide a weekly test of negative performance for employment or something else?
No, absolutely not. And we obviously strongly advise people that are still receiving symptoms, or if anyone's had exposure, to continue to test, to again provide them the very best information possible in order to get on with their lives.
Where's my data going? What are you doing with the outcome of your testing?
Yeah, so we fall and are responsible to make sure that we're operating underneath all of the HIPAA regulations. That being said, we report the number of positives to the state. That's a mandate that the state has. We will report the number of positives. We do not report individual names or individual information.
So, if I test positive, no tracking is going to follow from I take it from that.
That is correct.
Do you have any data on testing in our area, or is that a little too deep in the weeds for you?
No. So actually, we do, and that's a great thing about this company. The data is really helps us drive positivity ratings. Are very important to oversee. Now, that being said, the testing launched on November 23rd, and so that we've only tested a handful of days, so 5 days total since our initial launch. We've only tested 16 people to date. That being said, as we've seen in this process, it's all about getting the word out to the community, and that's obviously what we're doing and what we're really, excited about doing, because this ultimately this service that we're providing to the community is going to be helpful in making sure that the community remains safe. And so, as we get more and more information, as we get more and more data, we're able to share that with the municipalities, that then enable us to as a whole, as a community, as partners, to make some decisions on what we want to do. And so right now, very, very little information that we're driving, very few positivity percentages that we're seeing. So again, just as we continue to watch that week to week, we then are able to share that information specifically with the municipalities to give them some more understanding of what we're seeing.
Let's zoom out and talk macro scale. Are you seeing a change in the interest in testing? I mean, we all have COVID fatigue. We're all just so tired of this thing, right? Has Omicron created an additional interest?
Yeah, I think what we're seeing is we're seeing that people, though you're right, people are have got some definitely are tired of COVID and have a little malaise, if you will. What we're really seeing is that ultimately, especially this time of year, people want to spend time with their loved ones. They want to spend time in their community, and ultimately, we're seeing people that want to test because they want to do all those things and they want to understand what's going on. We're seeing a lot in a rather large uptick in school testing. As we should in this time of year. As a father of two small boys, believe it or not, I'm testing probably once a week with the Curative testing site that's located near me here in Seattle, where I'm based. And luckily, I have that opportunity. And we would want that opportunity for anyone, because ultimately, it's just providing us some really good information on what we as a family need to be doing.
So you probably have better access to data, certainly, than I do. What can you tell me about what's happening around the country, macro scale? What are you seeing? Are positivity rates up, down? What's going on?
Yeah, I think we're seeing just in line with the information that the CDC is producing. We're seeing kind of as we compare this time this year with this time last year. We're actually seeing it in the volume of testing. There's actually a small decline in the volume of testing from last year to this year, which is understandable. But as we're watching and paying attention to the new variants, we have seen that uptick in testing. Haven't necessarily seen an uptick in the positivity ratings, but it really depends on the location. And specifically for the Fort Wayne, Indiana location, we're just starting that kind of our data deep dive, and so we'll have a lot more information as we continue to test in the area. But right now, everything is pretty on par with what the CDC has published.
Anything I didn't ask you want people to know, Blake?
Just that, testing 10 a.m. to 4 p.m. daily there at Glenbrook Square Mall. Really excited about offering this to the community. It's going to be a great opportunity, and we're watching the numbers continue to grow as far as the number of people that are testing. We hire everyone that works for Curative is from the community. We train them to be healthcare workers. And so this is very much, as we like to say, people helping people. So the people from the Fort Wayne, community helping others. And we're really excited about being able to provide this testing opportunity.
That is Blake Lackey. He is the Senior Director of Operations for Curative. And if you need a COVID test, at least now you know where you can get one easily. Thanks, Blake.
Thanks, Lee. Appreciate it.